You mentioned how so many other things have to be ruled out before you can finally say it's fibromyalgia. When you see a patient come in, and how do you help them manage their pain from fibromyalgia?
Well, you do what you should always do. You gather a complete history from the minute the symptoms started until today. You do an evaluation, you assess the medical history, you assess medications. Just to give you a little example, many patients take cholesterol-lowering drugs.
Right.
Cholesterol-lowering drugs are known to cause pain in different muscle parts of your body. So sometimes just eliminating or replacing this medication will take care of the pain. And this patient didn't have fibromyalgia, he just had muscle pain from a cholesterol drug. Just to give you an example. So you always have to do a complete evaluation, physical history, gather imaging reports. You want to make sure that this type of arm pain doesn't come from the spine, which has a completely different treatment than if it comes from just the fibromyalgia.
Now, in the past, doctors would check 18 specific points on a person's body to see how many of them were painful when they pressed them firmly. How does that work? We see the protocol here. These are the 18 points.
Yes.
So walk us through this image.
Well, at the beginning of fibromyalgia, they determined 18 points in the body that if you would apply pressure to this, after a certain number of positives, you will call somebody fibromyalgia.
Okay.
That was a very rudimentary way of diagnosing it. As time has gone by, we know that fibromyalgia patients have a multitude of other symptoms that have to be accounted before you call it fibromyalgia. So I don't think anyone will diagnose a patient with fibromyalgia today based on those 18 points.
Right.
Anymore.
That's not protocol, really.
That's not, it's part of the diagnosis criteria, but it's just one of the diagnosis criteria.